If we're treating patients simply for snoring, the recovery for the different procedures are not that bad. In most cases, we're just stiffening the soft palate, so patients will have a little bit of a sore throat for 5 to 7 days. If we're treating someone for nasal obstruction, and that's the source of their snoring, it's simply the recovery from a septoplasty or turbinate reduction. Again, simply 5 to 7 days worth of recovery, where they'll have some nasal congestion, maybe some sinus pressure. For patients who require a larger surgical treatment for their sleep apnea, you may have up to 2 to 2.5 weeks of a sore throat associated with removal of the tonsils and stiffening of the palate. Even though treating sleep apnea and snoring can be a bit difficult, the fact is that it is treatable, and patients do find that the results they get are absolutely worth the treatments.